There are a large number of people, Mr. Müller, who have been diagnosed with osteoarthritis of the hip. Many of them end up having to have a hip replacement. Could you perhaps explain in general terms what osteoarthritis actually is?
Firstly, you said that the patient has to have an operation. The decision to operate depends on the position of the doctor. And in my view, doctors completely overestimate themselves, knowingly or not. So they perform as many operations as possible. Osteoarthritis itself is said to be a wearing of the joint or cartilage. This is true, as you can find out using a CT scan. But there is no connection between the wearing of a joint, in other words, osteoarthritis, and pain. Pain can be present without any wear, and it's also possible to have wear without any pain. For the doctors, it's an absolute gift. When they discover a joint is worn somewhere, they say that they have to operate. The patient simply submits to what the doctor says, despite the newspaper reports highlighting that more than 1,000 knee and hip operations carried out unnecessarily. I don't understand why patients simply lie down and accept this fate, like a lame sheep before a lion. When the doctor says they need an operation, the operation is then simply done and there is no second opinion. By definition, osteoarthritis does mean there is some kind of wear, but this is not necessarily associated with pain. The opportunity is seized with the realization that the victim, the patient, can be used to make money by having their hips done.
In many cases of hip osteoarthritis, a painkiller is primarily administered or cortisone injected. Is this also a way of avoiding the operation? For example, to avoid having to have a hip replacement?
Yes, in some cases. If the patient is not ready for an operation straight away, the doctor can be cunning and find another way. It's natural for him to try. When I go fishing and have a fish on the hook, I do my best not to let it go. Then the doctor recommends painkillers, injections, cortisone or something. It's the start of the end. This is when he knows he has the patient. There's no doubt that he'll land the fish. If the patient doesn't feel any pain and continues to walk around, they can place too much strain on the joint, improperly straining it. When the effect of the medication wears off, let's say, for example, that you're injecting saline solutions and you still have your own supplies that you're injecting. When this effect goes, the pain is worse. Then you say you were able to put it off, but now you need the operation. Alongside the painkillers, it's a way of not letting the fish go and keeping it on the hook. Because then the doctor comes back and says at some point that it's now time to operate.
I think that osteoarthritis is puzzling for a lot of people. There are those who say they have practically no pain, even though they've been diagnosed with advanced osteoarthritis. And there are those who are in extreme pain with every step they take, every time they move. Can you explain why that is?
Yes, it has nothing to do with the joint or the wear, but on agglutinated fascia. This comes from excessive strain and improper strain in everyday life. Monotonous movements that we make by walking on hard floors. Always the same monotonous step. The millions of ongoing impacts on the joints. This leads to the fascia becoming agglutinated around the joints, making the joint less mobile, and lack of movement ultimately results in pain. When the fascia are relieved and you do stretching exercises, the pain also subsides, whether you've got osteoarthritis or not. Osteoarthritis is simply a decoy for convincing the patient that they need an operation. The actual cause of the pain is improper strain in everyday life. Too much sitting and walking and standing on hard floors. The human body isn't designed for that. That's the real cause. Monotonous movements of the joints. It's not the osteoarthritis itself that is the cause and triggers the pain.
You just mentioned that the human body isn't designed to walk on hard floors. The fact is, hard floors are everywhere in a civilized world, and the majority of people also sit for too long. You're saying that if you make a change here, you can prevent osteoarthritis or wearing of the joint.
It might not be possible to prevent osteoarthritis and wearing of the joint. I'm not sure about that, and some people claim that cartilage can also grow back again, and you can build it up. There are even medications or dietary supplements that claim to promote the rebuilding of cartilage. I don't understand enough about this, and I don't want to get into that. I simply know that you can be pain-free again whether you've got osteoarthritis or not. When you change your everyday movements that have led to excessive strain, we are well known, for example, for our elastic springy floors for the office, less sitting, more standing in the office, but also for elastic springy walking in everyday life. We have designed the sole so that it feels like walking on elastic springy moss. 100,000 customers confirm that it works. It works, but not always. You sometimes have to do additional physiotherapy. Physiotherapy that relieves the fascia. Sometimes you have to do regular stretching exercises, but the combination of changing your everyday movement and moving more always leads to freedom from pain and practically always to pain alleviation. In very many cases, to freedom from pain. The benefit is that you can try it out. You don't have to take my word for it. One of my aims is to stop patients simply believing everything the doctor says like a lame sheep before a lion, and to get them to question what the doctor is saying. It's very easy to do this today using the internet. You can get a second opinion, perhaps from a doctor or someone who doesn't perform operations, someone who works in preventative medicine such as a physiotherapist, who concentrates on fascia or Kegel. You can try the shoes for 2 weeks for 30 Swiss francs and get lots of advice. But in most cases, it works quite straightforwardly and the risk is 30 Swiss francs. Once an operation is done, it can't be undone.
So you advise all patients who are told they need a hip replacement that they should get a second or third opinion?
I warn patients about believing their doctors. Demigods dressed in white. Despite reports of unnecessary operations in respected newspapers, in large newspapers, the number of knee and hip operations in Switzerland every year is growing by 10%, in some cases by 20%. We are completely over-treating complaints. In Switzerland, Germany and Central Europe, there are 10 times more operations or more than 10 times that in other countries where they have the same conditions. I simply warn people about the demigods in white or about over-trusting your doctor. All I can do is say it again and again, and you don't have to take my word for it. Feel it in your body and try out all the options. Find out more using the internet. But don't believe your doctor when he says you need an operation. Don't just take it at face value.
But there are also many cases where people report being pain-free after a hip operation or a hip replacement, and that they feel much better than before. Could you explain that?
Yes, there are of course many factors. You were given an anaesthetic and your whole system shut down. That's what relieved the fascia. Everything became much more mobile, just like when you have a cortisone injection. Then the operation was performed, an incision was made deep into the tissue, something that is very harmful in the long term. Actually, the next operation is already in the pipeline. As a result of the incision, an ingrained posture now has to find new avenues in the system. That's why you often have, I think, about 2 out of 3 of operations where the patient, it's even more in hip operations, about 8 out of 10 cases, is satisfied. But if you ask them again, after 5 or 10 years, the situation is quite different. Because that's when the next thing starts that causes complaints. It's the back, or very often the other hip, the knee or the Achilles tendon. The improvement is temporary and has nothing to do with the operation in the long term. By the way, there is also a double-blind study involving operations that shows, not according to me, but according to the German TV channel ZDF. This study is known among doctors and is called the Moseley study. The first group were actually operated on, and the second group were not operated on, but they were treated as if they had been operated on. They also went under anaesthetic, and a screen was set up supposedly showing the drilling, but the operation was actually being done on another patient. They shook the patient's leg and splashed it with water. The results concerning the pain were the same in both groups, even after 2 years. The supposed operation brought exactly the same benefit as the real operation.
Is there any proof beyond the 2 years? You said earlier that in those who are operated on, the joint is eased and strained less, but other joints are exposed to excessive strain as a result.
As far as I know, the Moseley study only looked at these 2 years, and no long-term studies have been carried out. But I'm convinced that those that were operated on have a worse prognosis in the long term than those that were not operated on. The body heals itself if you give it an opportunity and make changes to everyday behaviour. It's always better not to be operated on than to be operated on in any situation.
Thank you. I think you've given us a very interesting insight into what else you can do when your doctor says you have osteoarthritis and you need an operation. I say it again, you should always get a second or third opinion and not simply submit to what the doctor says and go under the knife. Thank you for talking to us, Mr. Müller.
Thank you.